So today we will be learning anemia complicating pregnancy. So be very attentive. Coming to the introduction part, in Mudaliar, they have first explained about the World Health Organization statistics. So the data show 40.1% of pregnant women worldwide were anemic in 2016. The condition is prominent in Southeast Asian countries. The incidence of anemia ranges from 40 to 90% in India. A marginal decrease in its prevalence has been noted in pregnant women in India from 58% in the NFHS3 National Family Health Survey 2005 to 2006 to 50% in the NFHS4 survey, that is 2015 to 2016. Anemia has a major impact on maternal and child health and is associated with a number of maternal and fetal complications. It decreases the woman's reserve to tolerate bleeding during or after childbirth and also make her prone to infections. Anemia is also associated with an increased risk of fetal growth restriction. Note these points, these are really important, and a premature delivery and low birth weight and maternal and perinatal mortality. There are four things: fetal growth restriction, premature delivery, low birth weight, and maternal and perinatal mortality. Anemia is one of the major causes of maternal deaths worldwide. According to the World Health Organization, that is WHO, anemia contributes to 40% of maternal deaths in third world countries. A sizable percentage of which are from India. Third world countries in the sense developing countries or the underdeveloped. In India, anemia contributes to 10 to 15 percentage of direct maternal deaths. Now, coming to the definition of anemia, anemia is defined as a decrease in the oxygen carrying capacity of the blood due to low hemoglobin concentration or a decrease in the number of RBCs. According to the WHO, an HB level less than 11 gram per deciliter is considered as anemia during pregnancy. In the postpartum period, a hemoglobin level of less than 10 gram per deciliter is considered as anemia. Okay. So, according to WHO, HB level of less than 11 is considered as anemia, but in postpartum period, less than 10 is considered as anemia. The Centers for Disease Control and Prevention, okay, CDCP they say, define anemia as hemoglobin less than 11 gram per deciliter in the first and third trimesters and less than 10.5 gram per deciliter in the second trimester, to make an allowance for physiological anemia. Now coming to the degree of anemia. Anemia is graded based on hemoglobin levels as shown in table 29.1. So these are the degree of anemia. Mild, according to WHO, it's 10 to 10.9. Moderate, 7 to 9.9. Severe, less than 7. Very severe, okay, there is no category under the WHO, but under ICMR it is less than 4 gram per deciliter. Postpartum, postpartum I think it's less than 10, as we saw earlier here. In the postpartum period, a hemoglobin level less than 10. So there's a slight printing error. It's less than 10 gram per deciliter. Okay, so let us make a comparison of the WHO and ICMR. Here the mild is 10 to 10.9. Here the same. Moderate 7 to 9.9. It's 7 to 10. No big difference. And severe less than 7, and here too we have less than 7. Coming to physiological anemia. During pregnancy, the plasma volume increases by 40 to 45%. This increase starts in the 6th week of pregnancy and peaks at 32 weeks. So start at 6th week and peak at 32 weeks. Okay? The increase of plasma volume is greater than that of the red cell mass, which increases to 15 to 20%. This disproportionate increase of the plasma volume and the red cell mass results in physiological anemia of pregnancy. The lower limits of hematological criteria to diagnose physiological anemia are as follows. HB level is 10 gram per deciliter. RBC count is 3.2 million per mm cube. PCV is 30%. Peripheral smear shows normal morphology of RBC. The reduced viscosity of blood in physiological anemia allows packed cell volume is 30%, HP level is 10, RBC 3.2 million per mm cube. ठीक है. The reduced viscosity of blood in physiological anemia allows adequate placental perfusion. So, let me continue the rest in the next video.